with Straightsmile Solutions, straightsmilesolutions.com. Let's talk about the difference between posterior bite bumps and a gelb or a posterior bite plate. And the photo I have here is a posterior bite plate or a gelb with a screw and a bow. Not necessary to have the screw and the bow. Bow is for retention, but definitely not necessary with the screw for most cases, but it's in there. It's the photo I had, but just wanted to let you know it exists. Anyways, basically, how do you decide whether or not you're going to do posterior bite bumps or a posterior bite plate? Well, what's the difference? Well, they both work. Let's talk about how I might decide. First of all, there's a lab fee on a bite plate, which shouldn't always be, I don't want to spend money on that. It's not a lot. It's probably around $100 US. Bite bumps isn't going to cost you anything, but it is going to cost you time. Time to put it on. You got to stack it a little bit at a time. Light cure, stack it. Light cure, stack it, light cure. Make sure it's even. And then grinding it off is even more of a nightmare. So it probably takes a doctor 10, 15 minutes to put it on and 10, 15, 20 minutes to take it off. I mean, that's doctor time right there. That's 30 minutes of doctor time. There should be a value to that of at least $500 to $1,000, I would say. So for me, if the lab fee is $100 and my value is 5 to 10 times that, well, then I'm going to probably do the appliance, you know. Plus, let's talk about risks to the patient. If you have posterior bite bumps on a braces case or on an appliance case for a few weeks, it's not a big deal. Maybe even a month, not a big deal. You know, as long as they're not like massive, because if they're massive, you're going to have all the occlusal forces on that one tooth. So it really just depends on the size of them, I guess. And if you're distributing over many teeth or just putting it on 2 teeth, I'd rather you distribute over many teeth if it's going to be on longer. The higher it needs to be, the more likely I'm going to say to use this, you know. So keep that in mind. The longer it needs to be on, the more likely I'd rather you use this. Why? First of all, you don't need this for an Invisalign case. This is for appliances or braces only. You know, if you're doing Invisalign, this is like a non-issue because they just keep the aligners in. So, I mean, it's one thing to keep in mind. Also, you might have to wear it while you eat. Just depends on whether you're hitting on the brackets or not, or hitting on the teeth that are temporarily, in a precarious situation. So all kind of things to think about. I think get to know your patient, get to know their parents, go over the risk, benefits, and alternatives. Would I charge more? No, I would not charge more. I think I'd give 2 options. One requires drilling, which could be sensitive. It doesn't need to be numbed up, but some people are not good with drills in their mouths. So if the patient has a phobia of drills, then definitely you're picking this, and they have a difficult time eating, but it is what it is. So I think it really just depends on the depth of the bite when they bite down. I mean, if you have a lot of dental crossbites and they're tucked in there and there's just no way they're going to move, then you have to lift the bite temporarily so that you get rid of the interference. Or if the patient is like hating on teeth and they're getting mobile because of the interference, that's also bad. Then better to have something like this, right? So just things to keep in mind. Personal preference. Always, if you're going to do bite bumps, you should keep a close eye on the teeth and never do it unless the patients are willing to do it. There's always another way. You can always do a removable appliance. You can always start on 1 arch first, takes longer. But if the patient is not up for having bite bumps, then you should come up with another way, even if they have to pay a little bit more. So, all right, thanks so much.